Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session with Lucy Barylak and Dr. Elliot Sklar. Today they're going to be talking about current issues in long-term care and what caregivers need to know about those issues. But before they get started, let me introduce you to them. Dr. Elliot Montgomery Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. And now Lucy. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center at a respite program for family caregivers. There, she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. In 2003 and also in 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, awarded for her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. Ms. Barylak is also a co-editor of a book for healthcare professionals entitled Responding Creatively to the Needs of Caregivers. She's been a key architect in screening and assessment tools of family caregivers, for which she provides training to healthcare professionals across North America. Lucy consults for private industry, including the WellMed Charitable Foundation and clinics in Texas. Additionally, Lucy is a liaison supervisor at the School of Social Work at McGill University, where she currently supervises 20 interns. She also was a caregiver for her mother for many years. Welcome, Lucy and Elliot.
Thank you so much, and
Thank
welcome
you.
to those of you participating today and hopefully watching this at some point online. We're thrilled to have you with us. So, we have been tracking issues in long term care settings for a couple of years now, and we recognize that there are so many issues. We can't possibly cover everything in just 1 hour. And also, there are some other current issues in long term care that involve a lot of emotions on the part of caregivers about placement. Just getting through the time leading up to placement, signing off on that paperwork, how to cope with the last night at home or the actual day of that transition. These are things we don't often talk about and things that Lucy and I are working on for future programs. But today, our focus is actually on the very practical. What is it that caregivers need to know right now as it pertains to long term care? What are the trends? What are the hot topics? What are the important issues? How are staffing levels doing? And how do caregivers complement the role that staff play in providing care for someone? Since the pandemic began, it's crazy to think 4 years ago, last month, COVID has been a part of our reality for 4 years, and we have been tracking how long term care facilities have been adapting. There's been a lot of change, and there have been a lot of hot topic issues that have emerged as they relate to patient care, changes in state policies regarding staffing qualifications in different states and minimum staffing hours, and also changing and evolving patient populations. All of these things are very important when you think about long term care, as caregivers are considering different options, different facilities. And the reality is that as much as COVID affected every one of us in different ways, it's undeniable how much COVID impacted long term care facilities early on in the pandemic and still now. So I think it's important that we distinguish that when we speak about long term care facilities, this is a very broad term that involves a variety of facilities, including assisted living, independent living, and also nursing homes. The data that we have nationally comes from nursing homes only because they receive funds from the state and federal governments, or both. Facilities that receive public funds are required to provide data on their operations, their patients, whereas private facilities are not subject to the same reporting requirements in all states. So that means that our discussion and a lot of the data that we'll be speaking about today during our program reflects the situation in nursing homes. So we will make those distinctions clear in our conversation. So some of the issues affecting nursing homes also impact assisted living facilities. For example, if there are long wait times at nursing homes for admission, then that can change the population that enters assisted living and for perhaps an unknown duration of time. So that impacts the population. And that is universal, no matter the long-term care setting. So we'll be talking about some of these things today.
Thank you, Elliot. This is really an important topic, and it kind of brings me back to when I was going through this experience, and it was really difficult. What I want to do is share with you that in January, the Kreiser Family Foundation released a report looking at nursing facilities, specifically examining changes in care, staffing, and looking at the overall nursing care population between 2015 and 2023. Their findings are quite revealing. So let's look into that. As of mid-December 2023, over 170,000 people living in nursing facilities had died due to COVID-19, highlighting long-standing issues in nursing facilities. In response to the high mortality rate among residents and long-standing staff shortages in nursing facilities, the Center for Medicine and Medical Services released a highly anticipated proposed rule earlier this year that would create new requirements for staffing levels in nursing facilities, which have been decreased over time. So let's see what happened with that one. The Kaiser Foundation's report showed that only 19% of facilities currently meet the required number of hours for registered nurses and nurses' aid, which is much lower rates among for profit facilities. It's only 10% when compared with nonprofit and government facilities, 40%. That's really surprising to many people. For-profit independent living facilities had much lower rates of nursing staffing than the government funding nursing homes, almost a quarter that required hours for registered nurses and nurses' aid in private facilities, which is quite shocking.
It certainly is. As Glenda mentioned at the top of the hour, I am a professor and I teach university students from undergraduate through graduate levels. I teach health policy. And I went over this report with my students, many of whom are PAs, nursing students. And this data was very surprising to them. And so I'm curious to hear from our participants what you think. Does it surprise you that staffing is actually superior in nonprofit and government-funded facilities than in private for-profit facilities?
So you can unmute your microphone, you can raise your hand, or you can put something in the chat box. All of those will work.
Well, I think what it's telling us, it's really, I was very surprised, Elliot, by that, I have to tell you. You'd think that private would be maybe a little bit better because it's private and you're probably paying a lot more. So that's why caregivers have to be really very, very careful. A private doesn't always mean better.
This is absolutely true, and things are not universal across the board. But the Kaiser Family Foundation is a very credible research and philanthropic foundation that produces a lot of important research about our healthcare system in a very unbiased way. And in looking at these trends over an 8-year period, this is the data that emerged. So we often work with caregivers who feel that if they're going to place a loved one or someone that they know in a publicly funded nursing home facility, that the care that they will receive will be inferior to a private facility where they would be paying. And that's not always the case. So that is actually, I think, almost a bit reassuring in terms of nursing homes, but it is also extremely important for caregivers to ask about the levels of staffing and quality of care at potential facilities that you might be visiting. And so that's why we really, really wanted to showcase this. Additionally, we're providing you with the same resources that we scoured and went through and read for hours. So you'll see links, hyperlinks on our slides that you'll receive a copy of after our presentation today. And you can click on those. There's a Medicare Care Compare tool, and that is where this national data comes from. And you're welcome to peruse that to look at facilities in your local zip code area. There's also another source of data called CASPR, which stands for Certification and Survey Enhanced Provider Reports, Survey Provider Enhanced Reports, rather. And it's a data set that includes a lot of metrics collected by surveyors of nursing facilities when they do inspections. So this is public data. Now, there are some other key takeaways that I think are also very important. And that's the number of nursing facilities declined actually by 4% in that 8-year period up to 2013. And also the number of nursing facility residents dropped by 12%. A lot of people might be wondering why that is, but it's because so many people passed away from COVID. And so the actual population of individuals in nursing homes is lower than it had been, and yet there are longer wait times for admission. So something here doesn't add up, right? So the decrease was also driven by a decline in registered nursing hours at 21% and a 10% decline in nurse aid hours. Licensed practical nurse, LPN hours, increased during this period by 7%. Now we know that these individuals make less money than registered nurses. So it's interesting, and I think it's important that we recognize that many for-profit private institutions that provide long-term care are just that, they're businesses. And so in a business model, you want to make high profits, certainly, but we need as caregivers to make sure that the quality of care when we're looking at these different facilities is as wonderful as it possibly can be to support the people that we're placing. So the other issue too is that there are fewer people who are wanting and willing to work in these long-term care settings after COVID. There's still a lot of COVID-related trauma among people working in healthcare, especially in nursing homes. We have to remember that it wasn't only patients who passed away, but a number of people working in those facilities too. And over that same period, the average number of hours of nursing care that residents received per day declined by 9%. So from 4.13 hours to 3.77 hours per day, despite the higher level of patient care needs by many people now entering nursing homes. So the number of overall workers in long-term care facilities continues today to remain below pre-pandemic levels. And that's very important for us to, again, think about as we're looking at potential facilities or if we have loved ones who are placed, to be able to ask these questions and to be very good detectives. And we'll talk about how to do that as well. So as of July 2023, and I'm sorry about my toggling between the slides, my keyboard seems to be a little sticky today. So I know that there was a little shuffling earlier, and I do apologize. As of July of last year, Medicaid was the primary payer for 62% of nursing facility residents. Medicaid for 62%, Medicare for 13%, because as we know, Medicare does not pay the majority of long-term care. They pay for short-term, and the remaining 25% of residents had another type of primary payer, so private insurance or out of pocket, etc. And Medicare provides up to 100 days of skilled nursing facility care under specific circumstances. So that's why you see that small portion of Medicare paying. But it's actually, this Medicare benefit is considered post-acute care and not available for people who need nursing facility services on an ongoing basis. So as of July of last year, again, the most recent data that we have, in the United States, 71% of facilities were for profit, 22% were nonprofit, and 6%, only 6% were government owned. So one of the hot topic issues we've discussed over the years that remains unchanged is that most people simply cannot afford long-term care, and there is not enough long-term care, which is why we have so many informal caregivers trying to do what they can. Medicaid was the primary payer for nursing facility residents, and Medicaid varies by state. Unlike Medicare, which is federal, Medicaid, again, varies by state, and Medicare, as I said, and I'm repeating it again, does not cover long-term care long-term. So it's no wonder that policies regarding levels of nursing staff in long-term care settings also vary from state to state, since it is Medicaid, which is state-run, that pays the majority of the bill. So in Florida, here where I'm located, for example, the requirements for long-term care staff are not the same as they are in Texas. During our program last year on these hot topic issues, we really did a deep dive into how these state policies affect care. And we have a link to that recording here at the bottom of the screen. So we would welcome you to listen in and learn more about these individual state policies. They're important because, as I said, if a state is paying the bill, then a state will dictate certain policies to make things more advantageous or equitable. So I'm curious, I know that a lot of these things that we've been talking about are not things that you often hear about long-term care. We don't think often about who runs these long-term care facilities. Are they for-profit, non-profit? Does that matter? What do you all think?
And for those that just joined us, you can raise your hand on Zoom. You can unmute your microphone, or you can put something in the chat box, which will remain open.
And as I said, things are not universal across the board, which is why we love to get people's input, reactions, opinions. I'm curious to hear from you all. Yes, I see we have some hands raised.
Cynthia. Cynthia, would you unmute your microphone? There you go.
Hi, good morning. I just wanted to share in this journey of caregiving for my mother, finding out that Medicare does not cover any of the long-term care services was a shock to me. And then finding out the qualifications required to qualify for Medicaid for her to receive services was an additional surprise. So it's definitely has a steep learning curve, I think, for caregivers. And then being here in Texas, seeing the difference between those Medicaid facilities that are available versus the private care. Also surprising to see the drastic differences in each of those areas. And so just a lot of surprising information. So I was really surprised to see the data from Kaiser that says those Medicaid facilities have better rates of staffing than the private do, because the private seem to appear better than the state-run ones that are Medicaid funded, and just aesthetically more pleasing, people in a better mood, I feel like, when I went out and toured facilities for my mom. So it's very shocking, I guess, for me on that piece.
Thank you so much for sharing that. I think a lot of people echo everything that you shared. And And I myself, I have been working in healthcare here in the United States for about almost 20 years. And when I first began working in partnership with long-term care facilities through the university with which I'm affiliated, their partnerships were with public nursing facilities and also private facilities. And I would walk into these private facilities that were so stately and elegant and opulent and beautiful, and they had people there to chaperone me through. And as I thought more about it, I recognized that these facilities I see advertised on television, in my local newspaper. Well, they pay for that advertising. There's a lot that goes into appearances and marketing, as we know. And if you think about it, nursing homes don't advertise on television.
No, not at all. Kathy, please go ahead.
Yes, hi, can you hear me okay?
Yes.
Yes.
Okay, great. Hi, I apologize. I jumped on at 11. I had to jump off for a couple minutes. I'm not sure you covered my issue, but I'll be very succinct. I live here in South Florida. I'm a board certified patient advocate, and I do a lot helping people with, issues, discharge planning, etc. I have a question that I'm not sure will be addressed or where you can direct me. I have a client here that was discharged from a hospital, needed to go to rehab, let's say 75-year-old gentleman, stroke, totally, incapacitated, needed 24/7 help. And his wife was probably not able to meet the needs. Long story short, they sent him home, but I was going to do an appeal, etc. The question is, when the discharge planner from the hospital in Florida, at least at this hospital, sent out to all the rehabs an electronic ask, can you handle this client? Here's the insurance. It was rejected. And one of the reasons it came back was, number one, they were in a Medicare Advantage, MMA, Medicare managed plan. And, they don't have to accept it. And also this poor gentleman, 50, 60 years prior, had a felony. And they wouldn't take him because they said the felony and also out of network. My question is, has anyone ever addressed this? And how can I help him advocate for him in a nursing home with this blemish on his record, which I don't know what to do.
Such a complex series of amazing questions that you ask. And I want to thank you for the role that you play as an advocate. I have worked a lot with formerly incarcerated persons in helping them find jobs, but I'm also very sensitive to the issue that facilities are rejecting people from a blemish on a record 50, 60 years ago. That's a major, major problem. I don't have an easy solve for that one.
Okay.
Now, with regards to the overall case, it seems like there needs to be better case management on the part of the hospital that was discharging him. There needs to be a caseworker, a social worker assigned to that individual, helping to follow up. But as we know, that doesn't always happen as it should. The other idea too, if you're not already working with someone from the local AAA, your area agency on aging, is they are supposed to have specialists in each office to help someone with the Medicaid eligibility process. So there's that piece of it, but there may also be a caseworker there who may potentially have a solve for the other issue of him being formerly incarcerated or having a blemish on his record there. They may have some suggestions here in South Florida for some facilities they may work with who are more open to their patient population.
Okay, well, I thank you very much. I've already consulted with some elder law attorneys. Maybe there's some case law. Maybe I needed to go to Office of Civil Rights. I wasn't sure where I was supposed to go, but I thank you so much, and I appreciate your help.
Of course, absolutely. I'm sorry that I couldn't be more helpful. That was the last thing I was going to suggest, was reaching out to the Florida bar to see if you could get a referral for an elder care attorney.
Thank you so much. I'm going back on mute. Thank you.
Thank you, Kathy. I don't know if you saw this over here, Elliot and Lucy, but Susan O'Barr, she says, I think the administration for the facilities is a big factor, and I agree with her. I have heard from friends that some facilities have frequent turnovers.
110%. I echo that as well. I had the pleasure actually of working with a doctoral student who was the CEO of a long-term care facility in Louisiana. And she has managed to retain all of her staff through the COVID pandemic and still. And I had asked her to join us today, but her schedule didn't permit because I wanted her to share that magic. And it has a lot to do with how she approaches leadership and values the people working in her facility. And I think we need to learn more about best practices because there are certainly a lot of positive things that people can share where that is concerned.
Thank you, Susan, for that.
A lot of great input. Thank you so much, everyone, for your participation. And Cynthia said, yes, leadership and passion for this work, 100%. And that's why we're all here today. So I want to thank you again for all that you do, certainly. And I will move it on to the next slide.
It's also acknowledging the work that people do and going out of your way to let them know that, you know, that's what leadership is about. How do you keep that group together? So there's a lot of more stats that I can give you, you know, and we know that in an industry that always had high turnover rate, the current workforce shortage, it really has been extremely devastating. And as you could see, there's a lot of statistics that are on the slide. But in the US, California, Florida, Texas, New York, and Pennsylvania are the top states where seniors live, but not all have the same nursing care standards to long-term care. They vary from state to state, so it's really important for caregivers to get educated about the issues where you're living. And so a lot of, you know, all the little websites that Elliot had put up are extremely informative, and take the time to look at it. So now we're getting to the bottom of this. So what are the implications here for caregivers? So if you are considering long-term care placement for someone, we recommend that you visit the website that Elliot mentioned and access the nursing home website for information on recent inspections, surveys, and various other information, including staffing levels, complaints, investigation, and general facility information. You know, no different than other things that you do. You want to go to a nice restaurant, you look at the, you know, what are they saying about it? It's important for you to recognize all the issues that some of these facilities may be facing. So if you're looking for a potential long-term care facility, take the time to visit the facility that you are considering. It's so important to talk to the facility administrators and take a tour. Let them show you around while you're visiting. Observe the staff and see how they interact with the residents. That's going to tell you a lot. For example, do they know their names? How do they call them? Visit near a mealtime and observe the meal service. Is it just thrown there, or is there respect? How are they treating the individuals? Does the food look good and smell appealing? It's also important to talk with the residents and family members and see what they like and don't like about the facility. You may also want to inquire about the different activities and specific services that are provided, which by activities, you know, it's very important to be able to socialize, to be able to have a cultural differences that you're sort of accustomed to. It's also important to visit during the evening or on the weekend when staffing levels may be reduced. You know, once in a while, just pop in and see what's really going on here. It can be very beneficial to begin this process as early as possible, even before your loved one requires a long-term care. You know, starting the conversation early may also allow your loved one to participate in the discussion and decision-making process. This allows them an opportunity to voice their opinion if they can, and make known their personal preferences for long-term care placement. Beginning this process early can also help to alleviate some of the stress and tension that this situation may cause. And wait lists, especially those with Medicaid beds, can be long. The other thing, starting early with other family members as well, to see what their thoughts are. Maybe some of them really, feel very strongly about keeping the person at home. So conversations are very important to start if you really feel that that's the direction that you're going. So in light of the data that we discussed and ongoing staffing issues in long-term care, even before the pandemic, it's important that caregivers understand the landscape so that they fill in the gaps when it comes to care or even companionship, okay? So it's really important for you to ask all the right questions about their staffing if you are exploring options, and speak with staff, as I said, with residents, with other caregivers, if you can. They'll tell you a lot about a situation. So the other thing, that if you have someone in a facility, be sure to keep an open communication with the staff. Acknowledge them, get to know them, ask their first name, give your name. So this way they connect with you, but as well, they will connect with the person you're caring for. And I have to say, bring goodies from time to time is an okay thing as well, or just by acknowledging or bringing a nice plant to put near the nursing station. But it's so important to make sure that basic needs are attended to, like personal hygiene. Know beforehand how many times your loved one can expect to have a shower, okay, or a sponge bath. So don't be surprised, but make sure that they do get it, and be sure to communicate concerns that you may have. And if you notice that there's a bed sore, whatever, don't just let it go. Let them know that ask the questions. Why? Follow up these concerns in writing, so there is documented or evidence in case you need to take more significant actions. So writing things down, writing an email so that you have it, they have it, is important. And it's also important to first ask the question without complaining. What's been happening? What's happening? Is it okay? Things like that. And again, I know it's asking a lot, but in the beginning, it's important to visit as much as possible. And with the understanding that the staff may not be spending as much time with that person, try to find ways to stimulate your loved one. So maybe when you visit, make sure that at the time you're visiting, you can do some activities with them, like throwing a balloon, listening, bring some of the music that they like, any kind of crafts that you can do. And looking at photo albums, we always said that that's a really good activity, reminiscing. Now, advocate for your care recipient. Caregivers are the advocates for the person, especially if you feel that they're not being looked after properly. So if you see any bruises or scabs you're concerned about, make sure to find out what happened to your loved one. Are they, especially if they're not able to tell you. Now, abusive situation can happen. And I think it's very, very important that, and sometimes those abusive situations don't happen necessarily at all from staff. It could be from other residents. But so you have to really keep your eyes open. So advocating for things like that, but also advocating for other parts. If you see that things are not being done, the medications, for example. So it's a lot of work. I know that, but at the same time, it takes time. It takes a few months for someone to get accustomed to a new setting. And it takes a few months for you as a caregiver to get accustomed to a new environment. It's a new society. And so it does take time, and you need a lot of patience. So I guess what I want to ask someone, does anyone have any tips that they would like to share, or any questions to ask about this whole situation?
Yes, Kathy.
Okay, I'm just going to weigh in a little bit. In my experience in dealing with some of the nursing homes, communication, as you know, is paramount. But if somebody's, let's say, going in for rehab for 2 weeks or 21 days or before, or even long term, I request that we put together a team meeting as soon as possible once your loved one is in the facility. I know that by Medicare, they're required every 90 days to do a meeting with the clients and the family, et cetera. But I like to know, what is the plan of care from day one to set the expectations? In addition, just educating the client, what are the patient's rights while they're in there? And I find that sometimes making a site visit and getting the information ahead of time will pay dividends later on, in my experience, because it's all about communication and follow-up. And I think sometimes the social worker at the nursing home can be your best friend to advocate for you for certain needs that you have.
You're absolutely right. You're bringing up a very important point. Yes. And there are many other things that could be put on a plan like that. Like, one of the things that I was concerned about is, what if there's a fire? What are their evacuation procedures, for example? And how do they deal with difficult situations? So you're right on. These are things that really need to be put on the table. People have to understand ahead of time. What is the expectations? Are they too large? Are they too small? And then there's a better understanding. So thank you so much for that.
Those are great points, Kathy. Lucy, I agree also. And for people that are in South Florida and perhaps parts of Texas and other areas along coastlines, hurricane preparedness, things like this, these are all questions that we need to be asking. And Kathy, I had another idea for you. You may also want to reach out to AARP. They do a lot of advocacy work and may have some people to put you in touch with. I think that could be a potentially good idea if you can reach someone there.
Thank you so much. I appreciate that.
Of course, of course. And, you can also look me up and reach out to me at my Nova Southeastern University coordinates, so that if I can be of any further assistance, I'm more than happy to help. It takes a village, as they say. And some of what Lucy was discussing is that detective work that I talked about caregivers needing to do in really knowing what's going on at a facility. I had a colleague who was in the midst of placing her mom, and I thought she was so clever. She was visiting facilities with her mother, who had Alzheimer's, and she used to take her mother out regularly with her, so that wasn't out of the norm, and she felt it was important to bring her mom to these facilities with her to visit. But she would try to see if there were potentially another caregiver who was also there visiting someone. She would usually try to connect with that person and see if they had a good connection, could she come back and visit that care recipient with her mom, so that if things worked out, she would be able to spend a little bit more time at the facility, because some facilities won't just let you come and pop in anytime. You need to have someone to visit. That way, if she was placing her mom there as well, there was someone familiar. And I thought that that was very clever. So different things work for different people. And I think that's why sharing of experiences from different caregivers through the caregiver teleconnection is so important. And again, appreciate all of you being here. So if we're looking, oh, Cynthia, yes, you raised your hand.
I did. I just wanted to share in my experience with looking for facilities for mom. I actually visited one that I think the director noticed I wasn't ready to place mom in the facility, but definitely was at a point where I needed help. And they offered a day program for me and having mom go on a daily rate while I worked. And we did that for 6 months. It gave us the opportunity to get to know the facility, get to know the staff, mom get comfortable with everyone. And when the need did arise, because mom was at a higher level of care, we were able to make that transition to her moving into the facility so much more seamless, because she was already familiar, and she was already thinking she was living there. She was getting confused coming home in the evenings with us. And so that's something that I think was great. And it just happened. Like I said, I think the director just saw the desperation in my face at that moment, but also me being torn with placing her at the facility. So maybe that's an added question that people can ask when they go in and tour places and see if that's maybe an option. And it gives you that opportunity to get to know the staff and the place, and just have a softer transition for your loved one when the decision's made to move in.
That's fantastic,
Yeah.
Cynthia. Great idea.
It's a beautiful story, and it's a very good tip. Thank you.
And thank you, Susan, for your comments. She said that was a great idea, Cynthia, as well. And yes, some facilities do have day programs, so that is a great way to sort of test the waters. So we're coming toward the end of the hour, and I wanted to wrap up some key issues and takeaways for our participants today. I think that what is so important is the implication for caregivers that really nursing homes have struggled with staffing shortages worse than any other health sector. And as such, many new nursing homes have reduced new admissions. That's been a major issue right now across every state in the country. And it's always been challenging to get someone into a Medicaid funded nursing home, for example, but it's even more challenging now. So, as advocates for caregivers and healthcare workers, we really need to be paying attention to the issues in long-term care, I think at any stage in our lives. Just as Cynthia shared, it was a learning lesson for her through this experience about what is covered, what isn't. Well, that has implications for our own aging and who's going to look after us when that happens. So we need to keep in mind that nursing homes and skilled nursing facilities are not just for the old. They're for the disabled, for people recovering from surgeries, accidents. Things happen. So the vast majority of us actually don't have savings to pay for private care if we needed it. The median American savings account today contains less than $5,300, and about a third of us have zero savings, according to the Federal Reserve. That can be scary. We need a cushion. So health insurance, disability insurance, workers' comp, and Medicare, they do not cover home care or nursing home stays. Private long-term care insurance premiums rise with age. Insurance companies charge women more than men because they live longer and deny coverage to those with often pre-existing conditions. Households of color have less access to mechanisms of savings and have less of a buffer to prepare for care. That's why about 90% of people across the board don't have private long-term care insurance.
It's really important. Most people are caught between a rock and a hard place. Either drain your assets and savings completely to qualify for Medicaid, or go without the care you need. So it's time to recognize that care workers are essential to working facilities in our economy. Our loved ones deserve high quality care and the ability to get the care at home. So if we had to sum up what we feel are the key issues, we want you to take from, the time together that we spend and to reflect the current issues affecting long-term care today. So as a result, it's more important than ever to work with your local AAAs to get help with long-term care in your community, because the landscape keeps changing. It's so important to know what your local communities can provide. What was most alarming to me was to learn about how inconsistent care standards are from one state to the next. As a result of that, it's also important to know what to budget for, what caregiving support you might need early on in life than we might need later on. I certainly know of people who've moved states because they had better healthcare access and quality of care in one place than the other. But that's a really big move to make. And I think we might see more of that happening. I hope that some of the things we share today resonated with you, and you can work with your local state AARP to help lobby for change and action.
100%. And we did have a comment in the chat from Pat, who said to get to know your local long-term care ombudsman. I couldn't agree more. The role of the ombudsman is so important. One other thing that was surprising to me is that the role of an ombudsman is often an unpaid role. So that is an advocacy role that someone takes on often as a volunteer. We have very few ombudsmen for the number of people in long-term care. So advocates like Kathy, my hat's off to you and thank you for everything that you do. Before we conclude today, I promise to leave you all with a very important piece of information that is very current as it relates to long-term care settings. Can anyone take a guess as to what that information might be about right now? I'm sure people are thinking staffing and planning and finances, but it's actually something quite a bit different and something we probably don't want to talk about, but it would be ethically unsound of me not to as someone in public health. And I'm sorry because it appears that some of the text is cut off in this slide as it's appearing for whatever reason. But as much as we're all tired of hearing about COVID, does anyone know what the #1 risk factor for complications from COVID is? Give you a moment. The answer is age. The same as it has always been. As we get older, we have more risk of long-term and short-term complications from COVID infection. Now, I teach epidemiology, which means distribution and determinants of disease. How does disease spread? We need 3 things. We need risk factor, so you have someone's age. We need the environment. And in this case, long-term care settings have a lot of people there together under the same roof, people coming and going, a lot of in and out. So that's why we had seen such high COVID transmission rates in long-term care settings early on. That's also why they were shut down, to avoid putting those at highest risk at further risk, making the environment a bit safer, because the last thing that you need, and it's called the epidemiologic triad. There are 3 things. You need a risk factor, you need an environment, and you also need a contagion. We know that COVID is very, very contagious. Well, what was shocking to me going through the most recent data as of the winter was that only about 7% of staff across the board at these long-term care facilities are up to date on their COVID vaccines. And only about 27% of all nursing home residents, and this is nursing home I'm talking about, in publicly funded facilities, okay? So only 27% were up to date with their boosters. So COVID is going back up. The dashboard that we have always been monitoring for COVID rates in long-term care have indicated that cases have doubled, and cases of staff contracting COVID have also gone up. That wouldn't be surprising if people are not up to date on their boosters. So last month, the CDC said that people 65 and older should get another dose of the updated vaccine that became available last fall if your last vaccine was more than 4 months ago. That is because, again, transmission rates are going up. And if you have someone in long-term care, we need to be mindful of that. Again, things are not the same across all states. In fact, the staff vaccination rate in Arkansas was 2%, and the highest in New Mexico at 18%. So if you have a loved one in long-term care, please ask the facility about their plans for boosting their population. If they don't have a plan to work with a pharmacy or some type of entity to do this, please go on vaccines.gov. We will be providing that information. You can get a loved one in long-term care vaccinated. Independent pharmacies will go out to facilities. Additionally, if you have a doctor appointment for your loved one coming up that you may be taking them to, doctors can also administer the COVID vaccine. So it requires a little coordination, but you can call 211 in your local community and get more information. This is very important. And as always, we have wonderful resources to share. We highlighted here at the top the Caregiver Teleconnection YouTube channel, where you can view recorded programs. We also have the Medicare Care Comparison tool, so you can find out more information about facilities in your local area. And of course, the COVID long-term care dashboard, which tells you about staffing across different states and how to get the COVID vaccine to someone that you may have in long-term care. So thank you again, everyone, for joining us. If anyone has any last questions or comments, please feel free. And I will pass it over to Lucy if you have any last things to share.
No, I just think that it's really important that if you're thinking of the possibility of placement, that you should do your homework before and take the time to really have a good understanding of the facility and the needs of the individual person that you're caring for. Also, culturally and language. Don't forget that. That's so important. That's going to be their home. So, you know, that's the facility. Are they accommodating for certain things? So this person needs to feel that they could speak to someone in their own language and have possibility their food or music that they enjoy from time to time.
All right, any other questions or comments?
Well, I can see. Thank you, Kathy, who said excellent presentation.
Yes, and valuable information. Thank you so much, Kathy, and thank you for all that you do. And Pat, thank you for your comment as well.
Absolutely. Well, while you're thinking about what else you might want to add to the conversation, let me tell you what's coming up on the Caregiver Teleconnection. I like to do that, give you a little heads up if you don't have the calendar. So next week on Thursday, the 18th, noon Central Time, one of our frequent presenters, Dr. Natalie Oliver, is going to be with us, and she's going to talk about trauma and self-esteem. Sounds pretty important for sure. And then on Tuesday, April the 23rd at 11 o'clock Central Time, another one of our frequent presenters, Dr. Barry Jacobs. Boy, this one hits home. I'm sorry to admit that, but it's true. Are you a control freak caregiver? So those of you that are looking for perfection in your caregiving, this may be the best session that you can get to this year. And I really encourage you to register for those. As Elliot said a little bit earlier, if you register for this session today, you will get a copy of the presentation with all of the hot links and all of the wonderful information that's been shared today. So I hope that if you have not registered, you'll call our customer service representative. I had put that number in the chat box early on, but let me give it to you again. It's toll free, 866-390-6491, and she can get that presentation to you if you did not register for the session today. So, did anyone think of something else they wanted to add to the conversation?
I just wanted to thank all the caregivers for all that you do. And please take every single day, take some time for yourself. Thank you.
So important, Lucy, you're right.
Absolutely.
Something else, Elliot?
If no one has anything else, just want to thank everyone so much. I really do hope that today's information was helpful. And please don't forget what I shared about COVID. I know many of us are tired of hearing about it, but we need to keep in mind that the #1 risk factor is age. And most people that we're looking to place in long-term care aren't in their 20s or 30s. So with that said, we want to protect people as best as possible. I think also asking facilities about their booster plans is another very good barometer of finding out the level of care in a facility, both for patients, but also for the staff that work there. And we talked about how important it is for staff to be recognized, appreciated, and cared for so that there isn't high staff turnover.
Absolutely. Well, thank you so much. I learned so much and got updated on my knowledge base about long-term care issues. So I want to thank both of you for your presentation today. And I want to thank each and every one of you for joining us today. Don't forget to go over to YouTube or to the Caregiver Teleconnection website and check in on our podcast because there's a lot of information out there that could be helpful to you. Once again, thank you for joining us, and I hope to see you real soon. Bye-bye.
Bye,
Bye.
everybody.
Thanks, everyone.